Let's say that you're someone who is interested in having transcranial magnetic stimulation, or TMS. What's the flow to get into the practice and actually start with TMS? It starts off with a phone call to the office where you'll talk to one of the office personnel who's familiar with TMS, and they'll ask you some screening questions to see if you're actually a candidate for TMS. And usually what that involves is that you have been on at least a couple of antidepressants and that they haven't worked for you. And assuming that that's the case, the next step is to get scheduled for a psychiatric evaluation with usually me. It may at other times be one of the psychiatric nurse practitioners, but the psychiatric evaluation generally takes about an hour. And during that time, we get your psychiatric history, your medical history, your symptoms, the history of all of your treatment. And we get the information that we need to say, yes, in fact, TMS is a good treatment option for you, and the information that we need to send to your insurance company to request what's called a prior authorization for TMS. We have a functional EEG that will take pictures, a graphic interface of how your brain is working as it's processing information, and it'll show us before treatment how your brain is actually working, and then towards the end of treatment and at the end of treatment, what changes have occurred in your brain. So that's something that we will generally schedule before you start transcranial magnetic stimulation. We wait to get authorization from your insurance company. Insurance companies have become really very good at authorizing transcranial magnetic stimulation, TMS, because it's effective. When I first started with TMS about a year ago, so December 2021, insurance companies were requiring people to fail 4 courses of antidepressants and 2 courses of psychotherapy. Now it's gone down to failing 2 antidepressants and 1 course of psychotherapy. The reason the requirements have come down is because it is more and more recognized how effective TMS is for patients who have failed antidepressant treatment. We have a pretty good idea of whether your insurance company is going to authorize TMS or not. The insurance companies are recognizing that for patients who have failed to respond to antidepressants, rather than trying over and over with the next antidepressant, that it makes sense to use TMS. So they're authorizing it much more readily. For your first TMS session, we do what is called a brain mapping. And what we're looking for is 2 things. First is the proper location where we want the stimulation to occur. And then the second thing is we want to get your unique, what's called a motor threshold. And the way that we find out these data points is by putting the TMS cap on your head. We adjust the locations. We're sending a 1 pulse magnetic stimulation. We're looking at your hands, and we're looking at when your hand twitches. Patients will sometimes feel a little bit of sensation in their face, in their nose, in their jaw. Usually very, very mild, not a big deal, but we're looking to see what location is causing a nice brisk hand twitch. And then we're looking to see what's the minimum amount of energy that's required to get that hand twitch. And that minimum amount of energy is called the motor threshold. And once we've got the location and the motor threshold, you'll receive a full course of treatment. The course of treatment for your first session and for subsequent sessions is going to last about 20 minutes. And the first series of stimulations, TMS sessions that you have, we're starting with energy that's well below the motor threshold. So let's say the motor threshold is 100%. We'll start at 40 or 50% of that and gradually increase that as we see that you are getting used to the stimulation. And ultimately, the goal is that we're getting you to 120% of your motor threshold. What you can expect is coming in 5 days a week. It's usually about 30 to 40 minutes walking in to walking out. And the actual time that you're under stimulation is about 20 minutes. There's 36 sessions. The first 30 run about 6 weeks back to back, and the remaining taper off. So the last 3 weeks, you'll go from 5 days a week, you'll do 3 days a week, 2 days, 1 day, and then you're finished. And that's what you can expect when you are looking to get TMS and the full treatment course. When we have your motor threshold and the proper location for where the stimulus, the TMS needs to be applied, there's a couple of things that can change over the course of your treatment so that your brain is not responding to TMS the way that it was when it was first mapped. And the factors that can make your brain activity change, number one is the amount of sleep that you get. We have a minimum requirement for how much sleep an individual needs to have before they come in for TMS. So if there's a night that you just don't sleep, you're up with a baby or whatever it is, we'll skip a day of TMS. If you have a change in medications that you're taking, we need to know that because that'll change the brain activity and we need to do a remapping. And also, the amount of coffee that you drink or the amount of alcohol that you regularly consume, if you change from your baseline level of intake, let's say you go from drinking 3 drinks, at night every day to not drinking at all, we would want to remap so that we're getting the proper location at the proper energy that's individualized for you.